Just in time. Greetings, everyone. I'm Luke Bryan Smith, and welcome to Enlightened, Empowered, Evolved, where we educate, motivate, and liberate you through enlightening dialogues, empowering music, and evolving content. I'm excited yet again because my next extraordinary guest is a board certified physician in internal medicine and lifestyle medicine, health coach, syndicated health columnist, speaker, and author of Patient Empowerment 101. And there's a whole lot more. But without further ado, allow me to introduce to you to Dr. Ann Hester. How are you doing today, doctor?
Too blessed to complain. How are you?
Absolutely. I'm doing great. And I love that too blessed to complain. Um, I always say I could complain, but what good would it do? And I don't want to place my energy that way, that in that place anyway. So
Yeah.
yes. I also would like to say that I'm a firm believer of that time is one of our most precious assets. And for you to choose to spend even a moment of your time here with me on Enlightened, Empowered, Evolved, I would just like to extend my sincerest gratitude to you. Thank you very much for being here at this present moment.
That's so kind. It's an honor to be here.
Absolutely. Let's get right into it. So, you're a board certified physician in internal
Mhm.
medicine. Let's just start right there. Lifestyle medicine, health code. Okay, let's start right there with a board certified physician in internal medicine. Give us a little insight on how you got into that and what led you that way. And yeah, and a little bit of your journey involved in it.
My father was a doctor. He was actually the first African American physician in Evansville, Indiana, way back when. And, I saw him and I watched him, how he helped people. And I was inspired and I ultimately decided to go into medicine.
Right.
And I spent a few decades practicing internal medicine. Basically, that's adult medicine as opposed to pediatrics or GYN. And then subsequently, I learned about another field of medicine called lifestyle medicine. And that's all about ways to help prevent, treat, and potentially reverse a lot of the diseases that we treat in internal medicine. And I went back and I got training and I became board certified in that as well. So my focus now is more on empowering people with ways that they can live naturally and be healthier, have more vitality, and likely live longer.
Wow, that's amazing, and I resonate with that because as I'm just going to be straight up with you. As
Mhm.
I've went through my journey, going through my journey, and as I'm getting older, I'm getting more into uh, health and eating right and taking care of myself because I can't treat my body like I used to. I'm not saying it was okay, but the effects wasn't apparent as they are now. So as I'm aging, hey, you got to take care of this. You got to eat better, otherwise, my vitals go off the chart. Blood pressure, all that, feeling, just everything. The way I look, the weight, all that. It's just yes, it's just better to take care of yourself, eat healthy, and find holistic ways to you know to treat yourself. Otherwise, you will be. And I'm not saying that there's no place for medication for pharmaceuticals, but in my perspective, you'll be on a bunch of them if you don't take care of yourself. Yeah.
Absolutely. 4 out of 5 visits to the doctor are due to lifestyle related conditions.
Right.
And there was a report, I believe it was the Commonwealth Fund, and they looked at all the rich nations in the world.
Right.
America is at the bottom. We have the
Mhm.
most chronic diseases, the worst outcomes of any rich nation. And as far as healthcare costs, we're at the top. And you can add a couple of them together, and you still don't get what we spend in healthcare. So we are big into treating diseases once they occur,
Right.
but we need to get into preventing these diseases because if most visits to the doctor are due to things related to lifestyle, that
Mhm.
tells you what the potential would be if we did things differently. And there are blue zones in the world where people often live to be 100 years old. They're
Right.
doing things differently than we do here. So we need to learn from that.
Right. Yes. There's a lot of holistic people that I follow as well. One being Dr. Sebi, and yes, he yes, and just people that I've met along the way that are into um, just herbs and natural medicines, and eating um, fresh vegetables, and showing you different ways on how to prepare them to make them more
Yeah.
appealing. And it's just putting that in my mindset, just knowing that, you know, we're fighting a battle here against, um, and I don't want to get into it too deep, but unhealthy foods being, pushed to us here in the US, constantly. So then that becomes part of our mindset to get,
Absolutely.
yeah, to get these quick foods that are overly processed and salted and, and sugars and just not really nutrient rich for our bodies, but
Mhm.
just a filler, if you will. And yes,
Exactly. And then comes the chronic diseases,
right,
and then comes pharmaceutical companies that say, I have the pill for this.
right,
And
yes,
so if we flip the script and we focus on trying to prevent the diseases in the first place or live
right,
longer in spite of them, and
right,
frequently being able to decrease our medication when our doctor says we can,
right,
then we could potentially live longer, have less pain and suffering, more vitality, and 20 years out, instead of being in a nursing home,
right, right.
incapacitated with stroke, maybe we could be hiking on mountains. And so we
Yes,
have tremendous amount of input into our health trajectory, tremendous amount. Most of our diseases are not related to genetics. If you look at a gene, 90% of the gene is like the background that we call the epigenome,
right,
and only 10% of the gene consists of the DNA consists of the individual genes. And so if you have a gene that predisposes you to diabetes and you're doing all the right things, remember that 90% of the DNA is the epigenome that deals with that part. So if you are turning the switch away from disease, it's not just your genes, it's your decisions and your habits. And those genes can turn off or on, literally, based on your habits. So you can do tests and you can see that certain genes light up or light down based on the lifestyle, the foods, all of those things.
that's interesting, and thank you for enlightening us with that information. That's amazing. And another thing I would just like to say is I'm very grateful for doctors such as yourself, and that leads me to say this. And the doctor that I have, I won't say his name right now, but I belong to what is it? I can't even think of
Concierge.
my hospital right now. It slipped my mind. But North Bay out here in Northern
Okay.
California is North Bay Medical. So I'm saying that the doctor that I'm blessed to have really encourages me in regards to lifestyle changes so that I
Mhm.
will can uh, cultivate that healthy lifestyle and get myself off whatever medications he's prescribing for me. So I'm so thankful for that because
That's
I haven't
huge.
I haven't encountered that too much. Most of the time, most of the doctors I've had, and not to talk bad about any, because I believe my journey is going the way it's supposed to go. But I'm just thankful that now I have one that's really holding me accountable as to what I'm doing, what
Mhm.
I'm eating, my exercise, and the habits that I have. So that's
Mhm.
amazing.
It
Absolutely.
is. The
Yes.
tide is turning, and doctors are starting to embrace lifestyle medicine more than in the
Right.
past.
Right. Right. Yes. And yeah. Wow. You're also so yeah, we know you're a health coach, so we can already hear that. Syndicated health columnist. Can you elaborate a bit on that?
Mhm. I just do a column for the price of business. I
Oh,
do a
okay.
monthly column on
Okay.
health, um, practical tips to help your health.
Oh, okay. Oh, that's amazing. And where can we find this again?
The price of business, just put in price of business, Dr. Ann Hester.
Oh, okay,
And
price
so
of it.
come up.
Okay, that's amazing. You're
And
also an author of Patient Empowerment 101. Can you give us an insight, a little bit of insight on that, how that book came to be, and a little bit of what it entails? What?
certainly.
Yes,
So
yes.
that's my internal medicine hat.
Right,
So my book, Patient Empowerment 101, more than a book, it's an adventure. It's all about helping people take a deep dive into how doctors think so
mm,
they can expedite their own diagnoses, lower their bills, decrease the chance of bad things happening in the hospital, and so forth. So it does everything from teach you how to create your 2 minute elevator speech. So when you go in to see the doctor, you can hit the bullet points quickly. So he can rule in or rule out things. And so by the time you finish your last sentence, he should have a short list of potential diagnoses, which
wow,
means fewer tests and procedures to confirm it, less medication that's not going to work, less cost, less risk to you. And so that came about because I saw this huge gap between how we think and how patients think. And it's because we never taught them how to communicate with us. What typically happens is people go into the exam room, they'll sit there with the flimsy gown, often cold. The doctor is another 45 minutes behind, and people are upset. They're in pain. They need
right,
to get someplace. And then the doctor comes in rushed and starts throwing out these questions and often interrupts the patient, not to be rude, but because they have so much time to get to the next patient,
right.
and the patients become flustered and they don't know how to respond. Now, I once timed a patient. I asked her a yes or no question. It took her 10 minutes to give me a yes or no answer because when she was there, she was thinking it through. Well, she had to take time to think it through. And so I teach people how to cut through that. When you
Right.
become sick, think of A, B, C, D, E. I give a basic framework that people can use. So whenever they get sick, they think of these bullet points. So when they go to see the doctor, they can spit them out like this. These are the things the doctors are going to want to know about virtually any condition, and it helps expedite the diagnosis. Then I go through how to be safe in the hospital, vocabulary that you need to know that would help you communicate with your doctor, how to get the best insurance, a variety of things. But it's really about teaching people how to bridge that gap between the doctors and themselves so they can get better care.
Dr. Ann, that was absolutely amazing and eye-opening and added a bit of clarity because now that I think about it, yes, our doctors have a different, mindset in regards to how they're, uh, processing information, and we might not be on the same wavelength. So this will help us, to be
Absolutely.
aware of that. So that is absolutely amazing. Yes, yes. And the reason why I was smiling and it is because I've been through that where I've come in and I'm aware now that, uh, that the doctors oftentimes, they're late, they're behind, and it's kind of like um, I'm at a loss for words, but like where you have one and then you have to go to another one, like an assembly line almost. You feel like that sometimes.
You feel that way for sure.
Yeah, yes, and they have other patients and they only have a certain, they're pressed for time often. So yes, I understand and resonate with everything that you
Mhm.
said and my experiences with the doctor's office. So yes, absolutely amazing. Also, you have a platform, ptrreset.com. Can you tell us a bit about that?
That is my lifestyle medicine arm. And
Okay.
so lifestyle medicine is an emerging field that is now in like 57 countries at least,
Okay.
and is based on decades of research that show ways to prevent, treat, and potentially reverse many chronic diseases. For instance,
Okay.
when I was in medical school, the thought of putting type 2 diabetes into remission was like the Jetsons. It's like, this is never going to happen. But after all this research, we now know how to put a lot of people with type 2 diabetes into remission and often get them off of the medication, halt the progression of the kidney damage that was leading toward dialysis. All of these things, the painful nerve damage that used to wake them up. that can be mitigated. And so that is just the tip of the iceberg, ways to decrease the risk of multiple forms of cancer or live longer despite that cancer, ways to decrease the risk of dementia, heart attack, stroke. I mean, it just keeps going on and on. So lifestyle medicine is basically made up of 6 pillars: a whole food, plant predominant diet, meaningful movement, connections. Meaningful connections actually release a hormone called oxytocin that counteracts the stress hormone cortisol.
Mm,
Another one is stress management. Then we have toxin avoidance. And the sixth one is restorative sleep. And so it's not 1 + 1, blah, 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 equals 6. You add these together, it's like 500 because they play off each other. They act interchangeably and they augment each other. And so when you do these things, you follow the 6 pillars of lifestyle medicine, then you are more likely to hit a variety of bullet points and hit that epigenome. So it switches those genes toward wellness and not toward disease. So PTR reset is prevent, treat, reverse. PTR, prevent, treat, reverse. So ptrreset.com. And
wow.
so there is a free course on there. It's the sneak peek that gives people a quick video of all the pillars. And then there are other levels of courses. But people also find other courses from other people because it actually started with my internal medicine arm when I wanted to educate people on a variety of conditions. And so I have an obesity course on there led by an endocrinologist, obesity expert. I have Coach Dr. Mike, who is recognized by the World Health Organization. He is an interventional cardiologist and a culinary medicine professor and professional chef. So I
Mm.
have a variety of courses on there for other things, but I merged the two. So if you go to ptrreset.com or patientworld.net, you're going to end up on the same page.
Wow. Thank you for that information, that vital, what I like to call vital information. That's amazing that you've developed this. And yes, it just, when I'm listening to you, I hear wellness, wellness, health, awareness, and cultivating and deterring, in a way that you can get in front of these problems before they happen and not even have them at all. So that's absolutely
Exactly.
amazing. And I want to add something to that. I eat blueberries, and I think you know what that means. I eat blueberries. Yeah, I found that out in one of my one of my uh, 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 herbal books or
Yes. Birds are
yes,
awesome.
yeah. So yeah, amazing.
Else, a little tidbit is they found that countries that consume more dark chocolate have more Nobel laureates. And I was asked one of my neurology colleagues, what is that about? And it's because they feel that the dark chocolate, not the milk chocolate, but the dark chocolate has very positive effects on the brain. And so you can get organic dark chocolate, the powder online, and it has like 25 calories. So sometimes I just take a scoop, put it in my coffee,
Mm, okay,
and it's like drinking hot cocoa. I'm only adding 25 calories, but
right.
I'm adding a powerhouse of nutrition for my brain.
Mm, thank you for that.
You're
That,
welcome.
that wow, amazing. I'm gonna try that. And I spoke with a friend. Actually, it was a mechanic. I took my car in to get an alignment, and we talked
Uh-huh.
health. See, I stay in that vibration,
There
and
you go. Wise
yes,
man.
yeah, I stay in that vibration. And we were talking about blood pressure because I went to the doctor, and my blood pressure was still a bit elevated. So he told me, he
Mhm.
said, take some raw honey and some garlic and chop it up and eat that. I don't know if you ever heard of that, but he said it will help. And I'm like, okay. But I just love connecting with people and getting their perspectives in regards to health and natural health and things like that. I stay in that vibration. So what I'm meaning with that too is that people automatically know that's the type of dialogues that I engage in, that life
Mhm.
affirming dialogues. Don't come to me with uh the world is about to blow up and this and that. Okay, I know that. Okay, but I'm not gonna. This is just me personally. This is not a an attack on anyone else. But yes, I like to keep my mind full of what I like to call life affirming information. And
Mhm.
that's what I like to stay on. You know, and
Certainly.
and if I am complaining, so to speak, or not complaining, but focusing on something that's non-life affirming, it's because I'm seeking a solution at the end. That's why, trying to figure it out or trying to figure out what the lesson is in
Mhm.
there. And that's it. That's how I've geared myself now. And yes, it's amazing. That's why having these, engaging in these dialogues are just elevating to me and just amazing. I love it. So, you know, um, regardless of the viewership. And I do want this to grow. I do. I'm not going to act like I don't because I want to get this out there. Yeah. But it just enhances my life. It really does. And then I want to share this experience with others. So it's amazing. Thank you so much, Doctor. Yes, go ahead.
My pleasure. I do want to weigh in on the garlic. So there is evidence
Okay.
that garlic can lower your blood pressure some.
Okay.
That being said, make that an adjunct. Don't
Mhm.
make that your center. I will never forget. I think I was a medical student, and I'll never forget this woman. She was on the back end of the emergency department, probably about 70.
Okay.
She had a stroke,
Mm.
and her blood pressure was like over 200 for the top number.
Oh,
And I
wow.
asked her about her medicine. It's like, well, I don't take medicine. I just use garlic.
Oh,
And so certainly there are natural things that can help. Beet juice can help. A lot of things
beet
can help.
juice.
Um, Restorative sleep matters. A
Right.
DASH diet. Google that, the DASH diet.
Dash.
Um,
Look that up.
DASH,
DASH. Okay.
DASH diet. That is a clinically proven way to help lower your blood pressure as well.
Okay.
But always follow up with your doctor because what may be good for one person may be enough to control their blood pressure without medication. Another person listens and may stop the medicine and end up like my patient who had a significant stroke because of
Right.
that. So you need to do everything in conjunction with your doctor. And if you find that exercise, maybe weight loss, dietary adjustments, and so forth, help your blood pressure to the point your doctor wants to decrease the medicine, that's great. I
Right.
have a client now, the doctor decreased the blood pressure significantly because of these lifestyle changes, but they can't do it on their own. So the doctor needs to know what's going on. And the doctor needs to be the one to say, okay, let's cut this dose in half, or let's hold on this one for a while and come back and see me and see where we are.
Yes. Yes. That's how my doctor is too. Because I've decreased um, the milligrams on a medication or two. So yeah, that's amazing because of what I'm doing. I'm doing a little bit more cardio and just cutting out the fast food. Um, yes, things of that nature. Lower sodium, not as much sugars and processed foods, fresh foods. So yeah, I'm steaming vegetables, chicken. Um,
Sounds good.
Yes, yes, and just eating more fruits. When I want a snack, instead of reaching for those bag of potato chips, I go and get a piece of fruit and cut it up. And yeah,
Yep.
yeah. So yeah, I'm actively doing, something, I just want to put this out there. And again, I'm not trying to call anyone out in any negative fashion, but just do little things. It can be hard because these foods are highly addictive with the salts and the sugars. So I know how hard and challenging it can be, but just start, because only you can really make that difference. I mean, you can rely on doctors to keep pumping you full of, pills and stuff to offset what you yourself are doing to yourself. But, you got to take some initiative and please allow dialogues like this to hold you accountable, and if you will, as I'm allowed it to hold me accountable as well. I'll go back and watch this, and I like watching information like this. It helps keep me motivated. Now, the ultimate motivator in my life is me, but I can be inspired, and I can continue to stay like what I said, what I mentioned earlier, that in that level of energy and thought and frequency. So this is amazing. Yes. Is there anything else, doctor, that I did not highlight that you would like to share, or anything that you would like to say before we
Well,
conclude?
first of all, you said that very eloquently.
Thank you.
Doctors prescribe medicine often as a result of diseases that never had to occur if people had done things differently. I just want to leave people with the concept of SMART goals, or like micro habits. So for those who aren't aware, SMART, S is specific, M is measurable, A is achievable, R is relevant, T is time bound. So let's say you want more vegetables. Be specific. I want to eat more green vegetables. S specific. More green vegetables. M measurable. I want 3 more servings a week. A is achievable. Yes, I can afford more vegetables. The supermarket's down the street. R relevant. Very relevant to your health. It can help you live longer. T time bound. Try it for a week. See how you feel, and then reassess. And so instead of trying to bite off a tremendous amount, if you do SMART goals, okay, now I've gotten through this SMART goal, I'm eating more vegetables. Now the next SMART goal is to eat more fruit, or the next SMART goal is to sleep 8 hours a day. So you do it stepwise, and over time, over a few months, those things add up. So
I agree.
that is how I want to, what I want to leave people with is you have power to take back your health.
Yes, yes.
And
Thank you.
please do so. You're
Yes,
welcome.
wow, thank you. I won't try to add anything to that. Very beautifully orchestrated. That's what I like to say. Thank you. Thank you very much again, Dr. Ann. And yes, for being here, and appreciate your knowledge, your insight, your wisdom, your intentions, your passions, your gifts. Just I can go on and on, but thank you for being you and for bringing you here to Enlighten, Empowered, Evolved.
It was
Yes,
an honor. Thank you for
ab-
having me.
absolutely. And thank you everyone for watching and or listening. Be sure to hit that like button, hit the subscribe button, so you can continue to get more of this information. This is what it's all about right here. And share it. Not only help the platform grow, but help get this vital information out to everyone. I appreciate you. And I just want to send everyone love and appreciation. Thank you for supporting me and supporting this and being a part of this. Until next time, Enlighten, Empowered, Evolve. See you soon.